percentage is right. If not mixed properly, the batches have hot spots or are overly concentrated, resulting in overdoses and death. To make illicit counterfeit pills containing fentanyl, people may purchase their own tableting machines, blenders, mixtures, colors, and markings. The tablets look similar to the real pills, but upon close observation, they may have broken pieces or impurities. Their edges may be rough and the lettering may be blurred. Where do these people get their ingredients from? In 2017, one notable trafficker was Henry Coffey from Philadelphia, Pennsylvania. According to U.S. Immigration and Customs Enforcement, Henry Coffey, who went by the name Narco Boss, was arrested for selling over 7 kilograms of Chinese fentanyl mix for over $284,000 worth of Bitcoin. Remember that this is just one of many traffickers. Now let's talk about naloxone, an emergency opioid antidote sold under the brand name Narcan, among others. Naloxone blocks the effects of opioids, especially in an overdose, and is sometimes called an overdose savior. Select the buttons to read about this important drug. When finished, select the Continue button. We strongly encourage your department or agency to have a naloxone program. Federal grants are often available to purchase naloxone for your agency for at least a year. Naloxone can save the lives of addicts in your community who are overdosing. It can also save the lives of officers who are accidentally exposed to fentanyl and other opioids. Unlike the commonly abused prescription opioid drugs that we have discussed, heroin is a Schedule I controlled substance. That means that heroin has no accepted medical use in the United States and has a high potential for abuse. Heroin comes in different forms. Black tar heroin is the crudest form, containing many impurities. White heroin, if processed the right way, is the purest form of heroin. All heroin starts out brown, but by adding chemicals, the heroin can turn into the pure white form. Take a minute to review how black tar heroin appears on the street. Note that these are small, street-level doses. When you're ready, select the Continue button. Heroin can be snorted, smoked, or injected by needle. Addicts with increased tolerance who have switched to the needle will likely start injecting in a few key areas, but they can inject anywhere that they can find a vein. This includes the arms, legs, between the toes, between the fingers, and in the neck. If someone is injecting into their neck, it likely means that they've run out of veins in their body. Here are some examples of the scars and abscesses caused by injecting heroin. The addict may be trying to find a vein, but as their withdrawal symptoms increase, they may become so desperate that they jam the needle into their arm or leg. This is called muscling the drug. When an addict muscles the drug, some parts of the drug do enter your bloodstream, but the addict develops awful scarring. Heroin addicts use several common items to turn heroin into an injectable liquid form. Take a moment to read about how these items are used. When finished, select the Continue button. Heroin addicts should never use a needle more than once. However, even in cities with a needle exchange program, many addicts use the same needle multiple times. It's rare to find a heroin addict who uses a new needle every time they inject, as this would require 4 to 6 needles per day. Select the magnifying glass to see an up-close view of how a needle is damaged after each use. As these images show, the needle gets more and more damaged after each use. The tip begins to look like a fishhook, and the remainder of the needle becomes jagged. Think about the damage this would cause to the skin and tissues of an addict as they pull the needle out of their body. In response to the opioid epidemic, the DEA and other federal and state agencies have worked together to promote several community response programs that prevent opioid abuse and assist those with opioid addictions. According to IQVIA, previously known as IMS Health, providers wrote enough opioid prescriptions in 2013 for every American adult to have a bottle of prescription opioids. The DEA has organized safe and secure drug disposal programs to prevent drug addiction and overdose deaths, while educating the public about the dangers of drug abuse and misuse. One such program is the biannual Take Back Day, which encourages Americans to remove unneeded prescription drugs from their households. Many local police and sheriff's departments have containers in their lobbies for the proper disposal of unused and unwanted prescription medications. These containers are available during business hours. Prescription drug monitoring programs are state-based electronic databases that contain a patient's controlled substance prescription history. The primary goal of these programs is to protect patients by helping health professionals identify patients at risk for prescription abuse. In 2005, the U.S. Department of Health and Human Services created a grant program for states to implement or enhance prescription drug monitoring programs. In 1971, the U.S. Food and Drug Administration approved naloxone as an antidote for opioid overdoses. Now, according to the Network for Public Health Law, all 50 states and the District of Columbia have passed laws to increase public access to naloxone. These laws vary from state to state, but a strong trend has been to empower pharmacists to distribute naloxone more independently. Also, 40 states have enacted Good Samaritan laws to legally protect those that report overdoses. As reported by the Center for Behavioral Health Statistics and Quality, a large number of individuals with drug addictions do not receive treatment, yet many face lengthy prison sentences for nonviolent, low-level offenses. The U.S. Pretrial Diversion Program diverts eligible substance abusers in the criminal justice program to a rehabilitation program of supervision and services. As these diverted individuals pass through special services, such as drug courts, they receive vital treatment and sanction alternatives to help them recover and eventually reintegrate into the community. This concludes the training on the opioid crisis in America. In the first module, we presented an overview of opioids and described the current opioid crisis in the United States. In this module, we described the most commonly abused prescription opioid drugs and identified evidence-based responses to opioid addiction and overdose. As a reminder, when responding to opioid-related events, wear proper equipment, including nitrile gloves, NIOSH-approved masks, and protective eyewear, and do not field test the drugs. Finally, make sure your department or agency has an active naloxone program. Thank you for taking time to complete this module. This training was presented by the National Criminal Justice Training Center, NCJTC, with funding provided by the U.S. Department of Justice, Office of Community-Oriented Policing Services, COPS Office. Select the Exit button to exit this module.